Welcome back to Balance Beings Uncut, where we talk about health, wellness, and everything in between. Today we have Chloe Young joining us, which I'm so excited about. She is absolutely amazing, and one of the factors we've been diving a lot into the clinic with children and with adults is mold. So we wanted to give you guys some understanding a bit more about what mold symptoms look like, how to identify if this is something that could be going on for you. If you're a naturopath student, looking at some factors that we can see on test results that might indicate mold, just so it's in the forefront of your mind that it might be something that you are actually dealing with and it's kind of under wraps because not a lot of people talk or look out for it. So we just wanted to give you guys that baseline understanding of mold and how to know about it if you're a client or a naturopath student. So take us a bit through a bit more about mold and what it is and how it essentially occurs. Firstly, Chloe.
Okay, so mold is an overgrowth that can happen in buildings, it can happen in the home, it can happen in the workplace, it can happen in cars, water bottles as well. And it mold exposure, it can disrupt that immune system regulation. It can also contribute to that kind of low-grade systemic inflammation, which can have very it can cause a lot of symptoms, which see a lot of time they seem like they're unrelated to one another, but to a trained person, they can kind of identify that there is like a bit of a pattern to those results.
Yeah. Yeah. Definitely. And so a lot of people don't really consider mold as something that could be affecting them and they go and clean it up in their house and whatnot. So what would you say the biggest symptoms are of mold and what to do if you see mold in your house?
So with mold symptoms, it is honestly like so diverse, the number of symptoms that are out there. But some of the common symptoms that I see quite regularly in clinic are chronic constipation, chronic fatigue, red sore eyes, frequent urination, painful urination, static shocks as well, feeling just genuinely unwell, depleted. In some people, it can actually cause chronic eczema and chronic rashes. It just don't respond to anything. And yeah, they're some of the most common symptoms that I do see. Also, hormonal imbalances, that kind of estrogen dominance picture can also be related to mold exposure as well.
I've also seen a lot of respiratory issues and asthma and like post
Mm.
grip.
Yeah,
Which,
that's true. Also, like them getting like people getting recurrently sick or like having shingles, those types of things.
yeah, so common. So if someone has
Mm.
mold in their house, what would you recommend doing? Because a lot of people clean it. Like, would you recommend them cleaning it with certain products, or what would you do depending on what the type, what it looks like, or where it is, or whatnot?
So general guidelines are if the mold is under 1 square meter, you can look at cleaning it yourself, but it does require like wearing like a mask and protective equipment to protect yourself against those mold spores. And then you can use things such as a solution made of 80% vinegar, 20% water. There are also cleaning products out there. One of the brands is called San Air, which can help with killing off the mold spores. Um, and then it also depends upon your genetic susceptibility. So if you are pregnant or you are immune compromised, then you shouldn't be cleaning that mold at all for yourself. That's when you would look at getting someone around, like a building biologist, to assess the extent of the mold. If it is soft, porous surfaces, so things like like mattresses and toys, ideally you would look at discarding those, throwing those away, or you can wash them in like a borax solution, ideally like a really hot, like wash them on a hot wash, minimum of 3 times to support the clearance of those mold spores. And those kind of non-porous surfaces, you can look at cleaning them, yeah, very, very thoroughly outside, and then airing them so that they get that bit of sun exposure to kill off some of the spores.
Yeah. And can you always tell if mold's in the house? Like if someone's not seeing mold in the house, do we assume that they don't have it either?
Yeah, a lot of time people who are affected by mold, there's no visible mold. So mold can actually grow behind like the walls. So behind like shower walls, underneath the toilets. I actually had a lady who she developed ticks kind of completely out of nowhere. And mold was suspected, but they couldn't visibly see any mold. They moved out of the home and the ticks stopped. But when they looked at remediating their home, the mold was growing underneath the shower. So the whole shower needed to be ripped out. And so they couldn't visibly see it, but it was still affecting their health. Additionally, a lot of people fall into that false sense of security where they're like, oh, I'm in a brand new home. There can't be any mold in this home. But when they are building the houses and they're putting up those timber frames, if they are exposed to a lot of rain in that building during that building process, that they're then going to be putting like all the gyprock over the top of those frames that have been affected by mold, and then that mold is inside all of your walls. Additionally, I have seen as well some information about how a lot of people who have solar panels on the roof, so when they're installing those solar panels, they actually have to drill into the roof to be able to run the wiring for that. And a lot of time they're not filling that hole. So that means that whenever there is heavy rain, that rain is able to get through that hole and falls into the roof, and then can make the insulation moldy.
That's crazy.
Yeah.
How would you prevent mold in your house? Is there any steps that you can do, climates that to avoid living in, and also what you can do in regards to mold? We're laughing.
Avoid
Chloe lives in the worst spot.
avoid living in the wet Sundays. We've just had 18 days of rain. We didn't see the sun at all for 18 days. And so, yeah, we've got like mold, like not big mold growing, but just like little patches of like mildew type mold coming, which I've been very paranoid about. But trying to maintain that the humidity in the house to around, I think they say it's about 40 to 60% humidity. So running that dry mode on the aircon. And also you can have like a dehumidifier running as well, opening up the windows, trying to get that bit of airflow. If you do spill anything, or if there are any leaks, cleaning up that water within 48 hours. So say if a carpet is wet for 48 hours, those mold spores will start. Another big thing is cleaning out the aircon units, which is one of those things that a lot of people don't do, particularly when they move into rentals. They don't look at that side of things. And a lot of time they've got aircon units that haven't been cleaned for literally years. And when they look inside them, they can see that mold build up. So every time they've turned that mold on, they're then blowing those those mold spores throughout the whole house. So ideally, depending upon where you are living, when you are in a tropical environment and you're running the aircon a lot, you would look at doing that, getting the aircon cleaned more frequently, whereas in those drier climates, that kind of like once a year is usually adequate.
That's amazing. That's really good tips. Thank you for that. Um, Take me through a bit more about gene susceptibility in mold and how that impacts things and what you would do different for treatment.
So the major genetic SNP that can impact the body's ability to clear out the mold, but also can make the immune system very responsive to mold exposure, is the HLA gene. So this one can make you more prone to the effects of mold because you're not able to detoxify optimally. So that's why you can sometimes have a family of 4 living in that household and only 1 or 2 of those people have the symptoms and the other 2 people don't, because 2 of those people may be carriers of the HLA gene, which makes them susceptible to the effects of mold, and the other people aren't susceptible to that. So their body kind of just detoxifies those symptoms without causing, it detoxifies the mold spores without causing too many symptoms. Some other genetic SNPs that can obviously contribute to that as well are things like COMT, which can impact the detoxification pathways, and DAO, the HNMT. Like if you are more susceptible to the histamine symptoms, mold does exacerbate those types of things.
Wow, okay. It's crazy. And so would treatment be different for someone that has these gene susceptibilities? Like what would you do differently? Or do we still need to clear out mold with people that are exposed to it?
Ideally, you would want to, the first step is always to get the person away from the mold. That's when you would look at treatment. Somebody who is a carrier of that HLA gene, you may need to go much more low and slow with that treatment, because you've got to kind of stabilize those mast cells. You've got to get their immune system regulation under control, reduce the inflammation, get them into a really stable place before you start then looking at that deep mold detox. Whereas somebody who isn't a carrier of those HLA genes, a lot of time they don't have any big symptoms, that you can kind of start moving into that detox process a bit quicker in comparison to somebody who is genetically susceptible to things like SIRS.
Yeah, 100%. So, take me through a case that you've had with mold, and did they get better when they came out of like the area, or like take me through some symptoms that you found have resolved through mold treatment, essentially.
Yeah, so I recently had a case of a little boy who was presenting with the most significant eczema that I've seen in my whole time at Balanced Beings. He was literally head to foot, and it really significant eczema, like a 10 out of 10 severity. When I looked at the gut testing, I did suspect that there was potential mold, because there was that high beta glucuronidase, there was the candida, the low oxalobacter formogens, and low pancreatic elastase as well. So I did say to mum, potentially there is mold. They were extremely fortunate that they were in a rental and they were coming towards the end of that rental agreement. So they were able to move out. And within weeks of moving out of that home, the child's eczema had reduced by 80%. He was constantly, like, chronically congested, and that completely stopped as well.
That's awesome. It's crazy.
Mm. Just from moving out of that rental.
Yeah.
Yeah.
And so take me through a bit more about steps of treatment for mold. Like, what do we do first, second, third? Is there like a process that we use for the treatment of mold? And how do we treat mold if they can't move out of the house and that's not feasible for them?
Yes, if you can't move out of the house, it's not feasible, then you would want to be really supporting those detoxification pathways as best as you can, but also trying to minimize the exposure to those mold spores. So running a HEPA air, like an air filter that has that HEPA filtration built into it, spending as much time as you can outside, so that you're not around those mold spores, and throwing away as many of those porous things, so things like carpets and rugs and teddies, discarding those, and then cleaning everything up as much as you can.
Yeah.
What was the other part of that question? You asked two questions at once.
I asked two questions. I always do that. I don't know why. Before I ask the question that I just asked, take me
Yeah.
through a bit more about the signs and symptoms we would see in a gut microbiome test if someone had mold. Just because I know we talked about it in our last podcast, but in case people are only watching this podcast, I just want them to know the things that
Yeah.
indicate mold in a gut microbiome.
So some key markers are low pancreatic elastase, can be high steatocrit as well, but also high beta glucuronidase. And that's because the mold does impact the liver and bile flow. So that means that, yeah, you're going to get that impacted bile flow, which can then contribute to higher levels of the Enterococcus bacteria species in the gut. And that's because they're bile-loving bacteria. So they really thrive when there is that lack of bile flow, along with a fungal overgrowth, so like that candida presence and low oxalobacter formogens as well.
Yeah, wow, that's crazy.
Mm.
So besides the gut microbiome test, is there any mold tests that you do, organic acid testings, or any other signs that we would see on any other types of tests?
Yes, there is a nasal swab that you can do, which is the Marcon's sensitivity test, and that's like the nasal swab, and that's really good for people who have, say, like hay fever, asthma, those kind of respiratory symptoms, because the mold spores can actually live up in the nasal cavity and can keep triggering that immune system response. Then you can look at like the genetic testing as well, so checking to see if that person is a carrier of that HLA gene, to know if they are going to be susceptible to mold illness. Then there is also the organic acid testing as well. So there are some markers in there that do indicate mold exposure. The organic acid test is also pretty good because it will also show you things such as glutathione, vitamin C, N-acetylcysteine, which are things that can be depleted by that mold exposure.
Yeah, awesome.
And then there are also the urinary mycotoxin testing as well, which is where you run a test to see how much mold is being excreted through the urine.
Yeah, awesome. There's definitely lots of testings that you can look at. What do you typically run first if someone comes in and you think that it's mold?
most people, when they come in, they don't actually suspect mold initially. Like it appears off of a lot of people's radar. So they usually have completely unrelated symptoms. So say like they have eczema, or they're always sick, or they have like fungal infections. So then that's when we look at things like gut testing. That's usually the first test that is usually ran. And then that's when we're like, okay, there's quite a few markers in here that could be potential mold. That's when we look at getting people to look into their living environments and their work environment to see whether they are having that exposure to mold. And then that's when we would look at further testing. So like like the genetic testing and the organic acid testing to see if we are on the right track. We think that there is mold exposure there.
Yeah, awesome. So interesting. So take me through the steps of treatment for mold. What would you do in your first case of mold treatment?
Mhm.
And what
So a
stage?
lot of symptoms associated with mold are to do with the mold destabilizing the mast cells and contributing to higher levels of histamine. So what we a lot of time work on doing is stabilizing those mast cells and having that antihistamine effect. So things such as Bakal skullcap, nettle is particularly good because it does have that antihistamine effect, but also it supports kidney function, and liver and kidney function and the nervous system are kind of like the three primary like systems that are affected by mold exposure. Then things like quercetin, vitamin C, zinc, those types of things stabilize those mast cells. It's really important to make sure that the symptom picture is stabilized, particularly if there is any signs of anxiety or depression for that person before you then start looking at clearance of the mold. Once they are in that very stable place, that's when you can look at using things like antifungals, like Powdiarco, pomegranate, those types of things. And then you're looking at utilizing binders. Binders, a lot of time you do need to be quite it's kind of like individualizing like what type of fungus or mold was detected. Different molds require different binders to clear them out.
Yeah, wow.
And opening up those detox pathways, that's the biggest thing as well, because a lot of people who have had mold exposure, they aren't doing a bowel movement every day because there is that impacted bile flow, and there's no point trying to clear things out if there isn't the basics there. So having that daily bowel movement, eating enough fiber, drinking enough water, doing exercise as well, getting the fresh air, make sure that those real basics are in place. Yeah.
What about candida and bacteria? Is there any links with clearing out those and how they impact mold at all?
So yeah, fungal overgrowths you are more likely to have a fungal overgrowth if you have had mold exposure. Yeah.
Yeah.
And that's because the mold is a type of is a fungal overgrowth. So yeah, then it does impact that immune system function, so that then when it is introduced into the gut or into the body isn't able to like fight it, and it kind of, rather than it being transient through the gut, it actually populates that gut lining,
So
the
if you had
gut.
someone that had candida and mold, would you go and kill off the candida or would clearing the mold kill the candida?
I think you need to do a bit of both.
Yeah.
Yeah,
So a lot
bit
of
of
times
both.
I find that like you have to kill off a little bit of bacteria and candida, and then that supports the mold and the symptom picture as well, like as a whole, I find. Just like with
Yeah,
bile and acidicrete, you got to normalize that to then get the bowels going to then help the mold.
yeah,
Makes
yeah, yeah, a
is
little bit of yeah. And then yeah, using those binders to actually get it out of the body as well.
there any specific binders that you use for different types of mold that you find, or is there one that
Yes,
you use?
yeah, we have one that we stock in clinic. That's the Quicksilver one. But you can also look at things like activated charcoal, marshmallow root, slippery elm as well. Aloe vera extract is meant to be good for clearing out the mold spores as well.
Amazing. Awesome. And so we've already talked a bit more about mast cells and the link to mold, which is awesome. Do you want to talk a bit more about how the mold impacts immune system regulation and those mast cells?
Yeah, so it does destabilize those mast cells, and it can impact the T reg cells, like the T cells and the B cells, like their balance as well. So when that disruption occurs, that means it does make the immune system more susceptible to viruses and bacteria. So some people can get things such as shingles. So people are, oh, I must be so stressed out. It must be why I'm getting the shingles. Whereas when you check the environment, the immune system it has been impacted by that mold exposure, and it has made them more susceptible to shingles, but also it can reactivate EBV, like Epstein-Barr virus as well.
Yep,
Yeah.
great. How do you address mold from a detoxification standpoint, as in what products do you typically think about using for detox when you have mold?
Yeah, so things such as opening up, yeah, all of the liver detoxification pathways, particularly the glucuronidation pathway. So things like calcium deglucarate, P2 detox, N-acetylcysteine can be beneficial as well. Dandelion root and globe artichoke for their bitter properties and their cholagogue properties as well.
It's always a mouthful to get that word going.
Yes, I think
Um,
they're good. They're cool words though, like just the way that they're spelt.
yeah, 100%. How long do you find it takes people to feel better after being treated for mold?
Oh, tricky question. Some people feel better within literally weeks of getting out of living in that mold environment, and then they get that kind of like 80% improvement, and then they then that's when they need like the treatment to continue that feeling better and better and better. It honestly depends upon the significance of the mold, like how much mold exposure there was, also how long they were living in that mold exposed in the mold, and also what those genetic SNPs are as well. So some people can have that really significant improvement within like a couple of months, whereas for some people it does take more like that kind of 6 month mark. Also depends upon how many of the body systems have been affected as well.
Yeah, 100%. So if someone can't see any mold in the house, but a lot of the symptoms are lining up to mold, what would you say, who should they speak to or see?
I would recommend organizing an appointment with a building biologist, so somebody who is trained in the identification of mold. So you do want somebody who will, like check the home, check the air cons, check the roof. They can also use like moisture meters to see if there are any leaks behind like the shower, behind the toilet, those types of things. Then they for some people they can be difficult to get hold of those services. Like there are very limited amount of people of professionals who are offering those services, which can make it a bit tricky. So just calling them, getting onto a wait list as soon as possible. But there's also the ERMI testing, which are like those mold plates that you can order online and put them in your home, and to see kind of what mold does grow on those little plates. So that one you can run yourself.
Yeah, okay, awesome, thank you. And with going back to the nasal passages that you talked about and how mold can actually build here, is there anything that you do specifically for treatment if that is positive, or do you just do a mold binder and the other pathways that we talked about?
Yeah, so there's like specific sprays that you use, and they have that antifungal effect. You have to be very what's the word? Very consistent with doing them, because that's what's going to clear out those mold spores. So again, it would be kind of that combination of doing the sprays, but also combining that with opening up those detoxification pathways, using the mold binders, regulating that immune system function, reducing the inflammation. It's that kind of combination effect.
Yeah, 100%. And if you have naturopaths that are watching and they aren't sure when to start looking at mold as a factor, what would you say, when would you say to do that? Um,
Um,
when
yeah,
it's
so like again, you can look at like some of the if you do like run say gut testing, there are the markers in the gut testing that can indicate that there is mold exposure. When you run a hair mineral analysis test, so things such as high copper can indicate mold exposure, and that's because the body does hold onto high levels of copper as a way of protecting itself from the mold exposure. And then if you do run say organic acid testing, then there are markers in there which can indicate the mold exposure as well.
yeah, so it's
Um,
really hard to
yeah.
identify really without a little bit of testing to help you understand what's going on.
Yeah, and there's no like specific 100, there's no like test that kind of indicates 100% like mold is the issue as well, which can be tricky. On a blood test, high bilirubin can indicate potential mold exposure as well. And high GGT, low cortisol as well.
Yeah, wow. So there's so many different factors on so many different pathways that impact and can be seen from mold. So these factors, we work a little bit more detail on like actually clearing them out and working on those factors, but then the mold too, and that's how essentially client symptoms normalize.
Mm.
Would you say that's the biggest factor you find?
Yeah, like yeah, it's kind of like yeah, calming it all down, getting the yeah, supporting those detoxification pathways, but also being consistent with it. Like a lot of people, like it does take time, and so a lot of time you do have to go quite low and slow, and people kind of lose that motivation because they're not getting those instant results. It's kind of like sticking at it, but also working out. A lot of people, if there has been mold exposure, a lot of time they do need either a low histamine and or a low oxalate diet, depending upon that symptom picture. And when you do take out those foods, it can give them a bit more of that symptomatic relief as well.
And I found a lot of clients I found with mold have been those really adrenal fatigue, low energy, lethargic people that are struggling to even go to work because they're just so exhausted.
Yeah.
And so if you're finding that you're treating clients with cortisol regulation or hormones and they're just not getting results, then that would be a good point to look at into mold as well, because that is a
Yeah.
factor completely missing for it too.
Yeah. Yeah, sometimes you kind of get to a certain point and then you plateau and then you're like, oh, they're not responding to treatment as well as what I would have expected them to. And then that's when you're like, all right, is there something more at play at this point? But in my initial appointments with people, like that questioning, I always ask about the history of mold exposure, like not just where they're currently living, but also where they have previously lived, because there is some research that has found that mold exposure that's happened 30 years ago can actually impact you 30 years later. And it
Especially,
can also,
yeah,
what
if
was that?
gene susceptibilities as well, really, you're probably not going to clear it out.
Yeah. Yeah. So just, yeah, asking those questions, because a lot of people, they say, oh, yeah, mum's house, when I lived with my parents, there was that mold. Or a lot of people, when they actually think of, like, a lot of people say, no, there's been no mold. And then you're like, you ask them more questions and like, oh yeah, actually I did have mold exposure when I was working at this job, or when I was at this university, or yeah, it is at this house. Yeah.
And just because there isn't any mold doesn't mean that's not the factor that you should be looking into. And a lot of
Mhm.
people I do find like ignore the fact that we think they've got mold as well. I think because it's an expensive route to go down, and so people
Yeah.
don't really listen a lot of times as well, and they really underdiagnose the effects that mold has. So
Mhm.
I find that a lot of times what we really, really want to do is making sure that we aren't like under looking into it because people are kind of fobbing it off in consults as well, because it causes so many issues. And it is an expensive problem to fix. Like if you've got an area that is fully infected by mold, you might have to replace that area, but it ends up being worth it if it's causing all your health symptoms at the end of the day as well.
Yeah. Yeah, sometimes it can actually be like they move out of the house, though, and then those walls have to be knocked down by professionals, and then it's all got to be vacuumed up. Like really, like it's a very expensive process, depending upon yeah how significant it is. But yeah, like you said, it can have really long-term impacts, long-term, can really be really detrimental to quality of life. But it's definitely worth that investigation.
Definitely. And
Uh,
also another common factor I find is people are like, oh no, there's no mold, but I had a really big water burst pipe in the
yeah.
house.
Hmm.
That's going and flowing and you're not properly clearing up and drying that area that the big like area burst, like it could be in between a wall. Then there's a high
Yeah.
risk of mold exposure there as well.
Yeah, yeah,
One,
absolutely. Or like people have like washing machines that leak, and then or like a dishwasher that leaks. I've had a few people where that's happened, and they've taken up the carpets or the lino, but then when they've laid it down, they haven't then gone back to see if the wood underneath has been affected by that, to see if their mold has grown.
and yeah, so wherever there's essentially water, there's possible risk for mold growth.
Yeah,
Even like what Chloe said at the start, building when you're building originally, if there's a lot of rain that's happened before the build's finished, that can really impact the mold rate in the house as well, which can then impact your health too.
yeah, definitely.
So in
Which
regards,
is when you buy a house, you don't know what you're getting yourself in for unless you do get like a person, like a professional around to do that inspection. Because the building and pest inspection, that doesn't test for if there's mold. Like it may detect like visible mold, but it's not going to check for the invisible mold.
yes, Exactly. And so another thing that I find is looking at your drainage, and the drainage around the house also impacts mold risk too. So if you're buying a house, looking at that drainage system, how it's going, making sure that you're not buying a house at auction unless you've done a building and pest, because a lot of, depending on the type of builder you get, you can get builders that have moisture levels too, like what Chloe was talking about. So when I bought my property, they did moisture tests through the house, which was really helpful too, and talked about
Yeah.
drainage and stuff around the actual building of the house because that impacts mold risk as well. So
Wow. That's
you
cool
can,
that that person did that for
I
you.
got him highly recommended as well by my person who helped me with the house. So yeah, some
Mhm.
builders do have like a moisture level, but obviously they're not going to be by like building biologists, so they're not going to have the degree
Yeah.
that we that complex level of understanding about mold, but it can still help reduce the risk that you're buying a house with mold, right?
Yeah, I'm just looking for like the basics. Like, is there any crack in paint? Is there any discolored paint? Is there any signs of bubbling paint, water damage? Has the house been exposed to floods before?
Yes.
So looking through that kind of history.
In a flood area on the
In a
area
area.
as well, you'll know because when you get insurance, it'll
Mhm.
be a different price.
Yeah.
So that's another thing to look at too, because then you're a higher risk of actually ending up having mold in your house from flooding as well, which we want to avoid as sea levels rise,
Mhm.
which is a story for another day. But is there anything else you'd like to add in regards to mold? Or do you feel like we've really hit the basics for patients and naturopath students?
That's it. Yeah, I can't think of anything else off the top of my head. But
I'm
yeah,
trying to
just
think of
making
that
sure
questionnaire. What's that questionnaire that we do? I'm trying to think of the names. People can look
the
for it.
MTHFR support mold questionnaire.
Yeah, that would be it.
Yeah.
Let me just get
Uh,
it up.
yeah. There's also the visual contrast sensitivity test, the VSC test as well, which is the test that is, I think it was free, but I think it might be $15 or something at the moment, where it checks the sensitivity of the optic nerve to see how well the eyes are functioning. Mm,
That's so interesting. So
yeah.
the HFR support mold illness questionnaire, it's something that you can get out online, and that will go through different sections like environment, gut, bladder, allergies, conditions, neurological, respiratory, and other areas. That gives you a total score to tell you the likelihood that you could be experiencing mold, because if most of the symptoms are mold related, then that can increase the risk that you probably have mold if they're all kind of lining up. So that can be something to look at as well with your patients to see if you think it might be mold, and it helps patients to more likely want to look into it more if they can have that visualization that, hey, these symptoms are actually lining up to mold. Yeah. Awesome. We'll put that link down below for you guys. And thank you so much for joining us today, Chloe. Until next time, everyone, may your days be healthy and your weeks be balanced.